Rain. It's a good thing. Even though I know that, what's the joke I heard the other day? If you feel the need to slap somebody, just slap them and shout mosquito.
Well, I hope you don't feel the
Okay, do we have anybody sign up for citizens' comments? No, okay. Then let's progress forward then. And we have 2.1. Armando Gonzalez will appear before the Board of Health to discuss LP&L issues and the possibility of the Board of Health becoming a health commission. Armando, if you want to go up front, so we can see you and let you. And because this is on the agenda, we can talk back and forth, correct? Okay, good. All right. Mr. Gonzalez, the floor is yours.
Thank you very much. My name is Armando Gonzalez. I live on East 3rd Street, and thank you very much for this opportunity to let me speak. First of all, I want to thank most profoundly Dr. Brian Carr and the committee, the tracking committee, that's done a wonderful job, Dr. Epstein, Dr. Reed, and the excellent presentation that Dr. Epstein made to the City Council. I think provided very conclusive and pertinent evidence that will safeguard citizens here in Lubbock. So my profound thanks for all of the Board of Health's participation in that. And I'm here to ask you a couple of things today. And I'm going to do something that I usually do pretty easily, and it's sometimes speak ignorantly about things. And one of the things is, I don't know your latitudes, your official capacities as a board, and I want to suggest this group of people becoming a commission or officers with authority to decide and act on things that are necessary for the health and well-being of the citizens of Lubbock and the surrounding areas. Again, speaking perhaps ignorantly, I don't know your capacity, your limitations, but I think that it's very important for you to act quickly and decisively on issues that may come about that need immediate attention. And it just doesn't make any sense to me that if an issue would arise like that, that you have to go to the City Council of Lubbock to get approval or get funding, et cetera, et cetera. And many examples could be outbreaks, diseases. We live in a city of over 260,000 people, and not counting the people that live in the surrounding areas. So there's a huge number of people that you are entrusted to see that their health and well-being are in order. And not just diseases, it's because of communications and traveling. This is a very small planet. Take, for example, tornadoes or anything that would require immediate attention and immediate decision-making capabilities from this board, where you don't have to go in front of the City Council to ask permission or ask monies for. And if monies are the problem, then maybe making applications to state grants, federal grants, et cetera, et cetera. I think you know more about it than me, and perhaps there's a way that you could make application or check into that to see. As a citizen, I think that this board has many times more responsibility to the citizens, residents of this community, than, let's say, for example, the EUB, Electric Utility Board. And the Electric Utility Board does what it wants to do. And then, the street department, the sanitation department, the water department, I think that your responsibilities here include a loftier, more important role because you're talking about the immediate welfare, health, and well-being of the residents. And in case of an emergency, in case pandemics, I don't know, there's a whole long list of things that could happen. I believe that you as a board need to act quickly, decisively, without having to go in front of another authority. That's one thing. And I mentioned the EUB, and I hope that, I know that all of you have considered the plight of residents because of the excessively high electric bills from LP&L. And many of you are medical doctors, and when a person gets cut off, it doesn't matter if they are elderly, if they are disabled. I mean, they cut the meter off. And I know this from experience that last winter I got very sick because I was out in the cold for an extended period of time. I had to go to the hospital. My cardiologist said, your temperature is very important. The temperature, your body temperature is very important to your heart. And so these oscillations, these fluctuations of temperature can greatly affect the elderly, the people that are ill, the disabled. And I would ask that you please intervene in what the EUB has done and what the City Council is lacking in, and intervene and protect the people that are most at risk. The children who have to suffer over 100-degree weather in the wintertime, people that depend on electricity to keep their homes. And I think that it's necessary for this board to intervene in what Lubbock Power and Light has done and look at their cutoff policies, the disabled people that are on life support equipment at home. LP&L doesn't care. They're going to turn them off anyway. And this is not a for-profit organization. It's a city-owned a municipality which is supposed to serve the people. Cost and money should be secondary, and they should provide a service to the residents here. And those are the two things that I wanted to ask for you to please intervene in the LP&L fiasco and the bad mistakes that LP&L is making, and please consider the effect of those disconnects and those huge bills on the poor, the disabled, the elderly, and people that to live have to have electricity. And I appreciate your time. That's all I have.
Well, I'll respond first, and then probably Scott or some other representatives from the city government. You know, the board, and that's certainly something we've looked at over the last couple of years, is the way it's set up. And I checked whenever you submitted the request to appear before us today. I sent some questions over to legal and just ask about, you know, what would be the possibility of, for example, the health commission or a more authoritarian kind of board. The way it's set up it is very clear we're an advisory board, and so to do that would require some pretty significant changes to city charter, et cetera. But I do think that we have a board and we're working together very well, so that even within the advisory capacity, I think it is within our purview of having opinions, position papers, presentations to council, but we are kind of limited in the current structure as to what we can do in terms of, we can certainly advocate, but we're an advisory position. So that does limit us there. Recognizing that the health of the community is very broad, I think that we've all individually watched what's been going on with LP&L, and part of what we can do is we may not be able to affect another board and what they're doing, but I think that it is within our purview to say that we really welcome the transparency and certainly are glad that you're here today and that any other citizens can come and know that we want to have that dialogue. So it's, rather than comment so much on what other boards do, we're just going to run our board as we think is appropriate to meet the needs of the citizens. So it's good that you bring these things up. And in fact, later on today, you're going to hear us talking about possible new kind of focuses that we have. So this is something that can come up in terms of, although ultimately I don't know that we can get where you want us in terms of becoming more of able to take action. We certainly want to be sensitive and say we want to serve as a research arm for the council and the mayor so that they get good, accurate, up-to-date information. Anything from you guys?
I would just add, and I think Mitch can follow up, that the Board of Health is mandated, I believe, by state law. It is in an advisory capacity at this particular point, and it will take action, much like we did with LP&L, to separate, and then it would take the coordination with the state law also to make sure that we don't get outside of the parameters of what the state controls. In the event of an emergency situation, be it disaster type or whether it be epidemic, there are provisions, of course, that we fall back on with our emergency management coordination between the city and the county, and the authority that the mayor and the county judge have to deem emergencies, and the responses that we have then fall in line also with the state and then to the federal government. So certainly I'm not aware of anything in my past 35 years that we've had any issues with in response to any of those type of situations. If it was deemed important enough that it came from staff, normally, and the health director, then the board didn't normally even have to be involved. It was taken care of. And that's the way that we see it, and we proceed in the future. If anybody else knows of anything that I've missed in those past 35 years, because I did sleep some of that time. Certainly, I'd be happy for you to speak up, but I think we do a great job of response, and the health department. Certainly, we can always be better, and that's why we have this board. That's why we accept opinions from the public and want to take those things forward. Mitch, do you have anything that you could add to that?
I really don't, Scott. That's nicely done. I think you laid it all out. If there was one small thing I could add, it would be just to recall and remember, it's nothing you don't already know, but this committee has the ability to seek out and discover any kind of issues it feels like are relevant to its charge and present those. So you can act unilaterally in that way if you don't have to be charged to look for anything, so long as it's a matter of public health concern. You've got the authority to do that right now. So.
Okay. Presley?
I understand. I agree with what you're saying. There's all kinds of emergency response, medical emergency response and everything else set up. But I am concerned, and I'll ask you, Armando. I was under the impression that there were numerous private and government agencies or resources available. If someone's electricity was going to be cut off and they petitioned these groups, that there could be an extension or some kind of delay, especially for medical reasons.
I would tell you along that same line, I've not ever been aware of LP&L being made aware that there was oxygen that had to run off of electrical hookup or something that if they did not know about it at the time, or they were not made aware, that they did not cut off that electricity. Now, I could be wrong, but I'm speaking of in the past, but I don't know of a specific instance where if they had knowledge of that, they did not try to work with that. I know there are funds set up within LP&L also that you donate a portion of whatever you choose to, I guess, or $1, you round up to the next dollar, and that goes into a fund to help with that specific situation. Is anyone aware?
Well, I know there's a form you fill out as well that needs to be signed and attested to by a doctor that you're under their treatment and that you require you require a piece of equipment or something of that nature powered by electricity. And I've even heard of, anecdotal of course, that if a piece of equipment runs on X level of power, that in fact you could reduce the amount of power going into the residence down to that level if you had to at a bare minimum. I don't know how often that happens, but I do know that there's a form in place that the customer can fill out and
But
Yes,
how many
sir.
people know that? I mean, I think that's an educational problem there.
Well, and also, I know that my church, and I'm aware from recent news reports that there's other churches that do utility bill assistance charities.
Yes, sir. Thank you for bringing that up. And what I have learned and know from experience, many of those resources are very limited, and many of them may offer $50, $75, and there are special programs that one can go into, but they have special requirements. For example, if you make $18,000 a year or less, then you qualify for certain things. But if you make $18,010, then you do not. And so those are people that are falling between the cracks and that desperately need help. Also on the life support equipment, right now as it is, LPML requires that the doctor fax or send a letter. I believe it's every 60 days. And for an individual who is ill, they have to coordinate their doctor visit so that he can request that. The doctor is not just going to send letters, automatically to LPNL. The patient has to request it. So it's a very time-consuming thing where it might take up to 2 weeks to get that letter. And then even after you get that letter, you still get your electricity turned off. And what they do, they leave just enough amperage to run that machine. So that, in a way, is a little more cruel than turning everything else off.
One thing that might be helpful, Armando, is if you want to spearhead some of the effort and help coordinate our review, this is obviously not just a problem for Lubbock. That, for example, I was talking with someone the other day about some issues of feral cats and things at Texas Tech, and they said San Angelo State has got a program which is, in this person's opinion, much more humane. And I said, well, get me information about that program, because it's helpful to not only identify a problem but a solution too. So it would be very helpful if you could dig and see what other cities are doing, so that even like what Kay is saying, that if there's an educational component, that what is it that other municipalities are doing to educate the public about these forms, and then that helps our recommendations, because we can then say here's a model for what it is that we're talking about. So just a thought of where I'd ask for your help.
Thank you, Dr. Presley, and all of you for your
Okay,
comments.
Dr. May?
Oh, yes, Dr. May, how are you, sir?
I'm doing well, as always, Armando. It's always a pleasure to see you. You brought up some very, very good points.
Same here.
I think cost of electricity, Dr. Carver, is one thing that's very important for us to discuss here. Also, the problems that we get into with federal government regulations. Armando brought up a good point. Excuse me. Cutoffs, $18,000. You can get you can get help. $18,000 you don't get any help. So a normal person is going to try to make as much money as they can to help themselves. And one of the problems that we're dealing with, I think, would be good for this board to look at. And we're not going to change it single-handedly, but we really need to get the welfare back to the community of Lubbock, where we know our people, where we can look at somebody and say, hey, they're making $20,000 a year, but they need as much help as somebody who's making $5,000 a year. Or we as neighbors are watching out for our neighbors. I think it would also be good, Dr. Carr, to get to find out from LP&L what their policies are on this.
Staff will do that.
Yeah, we can. I think that would really be good. And again, not a challenge or anything else, but just so we have some facts, so we know where reality lies and where rumors are and so forth. We may find out it's better than we think, or we may find out it's a lot worse than you're anticipating. You bring up another thing, the cost of electricity. I really think we need to look at this. Because, again, this is a federal government problem. We shut down 200 coal-fired power plants. The cost of electricity is going to go up. The cost of natural gas. Most of our electricity is now being turned over to natural gas. Best way to have low electricity is to lower the cost of natural gas. It's turned down from $12 to $2. But, besides the coin, if you want cheap natural gas, the best way to get it is fracking.
I agree.
And the best way to get it is fracking. And then the other thing is competition. We went from 2 electric plants with competition, good healthy competition, some of the lowest rates in the country when I moved here, 2 power lines going down the street, to 1 entity. That is not a good move. We can't do anything about it here, but we need to look at that in the future. And the other thing, of course, is the government, the EPA, Endangered Species Act. All of these factors come in to the cost of our energy production, and you just nailed it. Because the poor people get hurt the worst, because we're not like we were 100 years ago, where you open up the door of your log cabin and let the air flow through.
Oh, yes, sir.
We've got air conditioning.
People get acclimatized, and to your reference about fracking, I agree that fracking is a good thing, as long as there are ordinances and that there are protections in place so that someone doesn't get poisoned if they're sitting next to a well.
We got to be careful. It has to be a balance, because every regulation you put in puts up the cost of producing that natural gas.
I understand we have to work together to
Yeah,
achieve those goals.
Yep.
And I really appreciate it, and I'll do some homework, Dr. Carr.
Thank you.
And maybe next time I'll be able to bring
Sure.
a better report. But I think that the issue that is 2 issues very salient. Quick action, and I understand that emergencies are covered by your policies now, but long-term things should also have the same rules that you have available for emergency matters, where you don't have to go to the city council to get approval for everything. And like I said, I may be talking ignorantly, which I do a lot of times, but it's just something to consider. And people that cannot speak for themselves, the elderly, that cannot pay their phone, their bills using a phone, or that don't understand the billing system, they suffer. And that suffering is what I want to present to you today, so that you can be made aware of, and if you're inclined to, please intervene.
Okay.
Thank you very much,
Okay.
Your Honors.
All right. You're on.
Thank you, Armando.
Thank you. All right. Work session 3.1, discussion of the position of health educator, including but not limited to the duties and prioritization of goals and objections for such if the position is approved by the City Council. Scott, what do you got?
Becky and I were talking, and what we'd like to do is basically, and if we can't get too far into this because we have to have the managerial discretion in order to manage that person on a day-to-day basis. But what we were looking for is general guidelines, or maybe 4 main topics of education that we would like to hear from the board that you would like to address if the position is funded in the upcoming year, so that we would have a starting place in order to not have to come back at a later time and reinvent the wheel after we've got the wheel on the wagon. We want to make sure that we know what your priorities are. And when I say 4, 4 will be plenty when you start branching out under those main topics to see what it's going to take to deliver those messages. So that's what we were after today, hoping to get some consensus on the topics that we would like to have that person address.
And it would be one, would they have staff?
Just one person.
Just one person.
One person, and they would have to, of course, produce the majority of their materials. We do have budget in there for them for supplies and those kind of things also. And any other help that, of course, you could garner from Tracy and whatever staff is there.
All right, Kay.
I know
Yeah.
I'd like to.
You're welcome.
One of the things I think, too, that we have to do is clarify the supervision, the medical supervision of this person. Because when we tried to do some public education in the past, even our city manager was critiquing what a physician had written. And I think that the lines of communication, the lines of supervision have to take into account that this board has the ability to look at what messages are being sent and critique those.
I would agree with that, Kate. My only parameter that I would say that we have is that in the past, the city council has been very direct over what type of terminology and I guess the methodology of the delivery and the parameters on how far we go as to what we would define as, I believe, sex education. If that's one of the topics that you're talking about that you want to be a priority, and what they as a body by policy are willing to fund as to what they feel that public dollars should be spent on and the message that should carry. That's the only thing I'm aware of at this particular point that would be that we would have to be very careful of, and without specific guidance from the city council. But I can tell you, as you know, from the past, we may be limited there into what program or what we can deliver as an educational program.
Okay, that may be the exception, but I think on most things medical, they have to defer to this board. And I don't know how we get that in.
I'm not aware, other than maybe some of the wording or maybe the choices that they have, but I'm not aware of any other policy decisions by the council. We'd still have to have it reviewed. That's why we have a medical director, and the information that goes out, of course, would need to be reviewed by that person for, I think, appropriateness and correctness and the things that come back. We want to do that. And certainly Dr. Cook's been great to work with us on all of those things.
Ollie?
So, as far as what I would look for, I would like pretty much focus on like the STI education and sex education when it comes to awareness and prevention at like the high school level and at the college level with this position. Now, I'm not aware of how the previous role was. What was the main focus of the previous health educator role when we did have one?
I'm going to ask Becky to answer that, as she was more closely associated.
On our previous health educators, they pretty much taught across the board. Anything that they were requested to come into the areas and teach, they pretty well taught on. And like Scott has spoken about, the only thing that they were really restricted on was what they could say as far as sex education.
As far as terminology.
Mm-hmm, terminology and factual. Some of that was a little bit limited, but as far as going into schools or going into the community, they pretty well spoke on just about any topic they were asked to speak on.
Okay. So could we use those previous responsibilities as kind of like a template for what this role would be?
On a first-year basis where somebody's going to be developing programs, and we had multiple people in those that she's speaking of. Like at that point, I think we had 3. So I'm really looking for this person to be able to develop those things, get it reviewed, from not only a standpoint of what does the public want, but what do we need to address as a public health body. What do you think that the important things are, so that we can start there, and then we can fill in any blanks that we feel necessary after we get the program up and running. If it is certainly approved by the council. We have to have that part first.
Yeah.
And part of my reason for asking how many is because there's Ollie's primary focus would be sex education, as others in here may also. Mine might be infectious diseases. We all have our passion for different things. one individual would, in my opinion, would be more coordinating, working with school nurses or whatever, Lubbock ISD, working with community group senior centers. You know, that's sexually transmitted diseases in the senior population is a big deal too.
Sure.
So I think we're all going to have to come to a consensus on what the 4 priority health issues are in Lubbock. But it would take a super person, I think, to be able to adequately address 4 public health issues and adequately address them in the community, to provide training that was anything more than a Band-Aid.
Well, if I understand what you're saying, the idea would be whatever the 4 subject areas are, to appreciate that since it's only one person, that the process is probably going to be more of them being a coordinator
And a
of
facilitator.
those services as opposed to the actual, maybe the educator. Some of that will take place, but that they're going to be trying to coordinate among all the existing resources to bring that to bear for the larger purpose. Is that
They may
sort
not
of
do
where
all
you're...
the speaking. They may find someone that's an expert that's already speaking on that to deliver those programs, such as you're saying in the coordinator spot. But remember, any public institution that we go into, that curriculum is going to have to be approved by that body also.
Right.
Oh, I understand, but
Right.
there's non-governmental organizations, and, you know, charitable groups
Sure.
that have trainers hired and all of that. I think that person, a lot of words for a short message, which is, you know, that person's going to have to be involved with the community, not just the Lubbock government, or get out and get about, find volunteer groups,
Our problem
nonprofit
is
groups.
there's so many of those issues, we believe, that without some focus from y'all, you can get
Oh, I agree.
you get so diluted in your point of trying to decide what you can and what's the most important thing without the guidance from the board. You know, that's why we wanted to start there with what is the most important things, and then we can work and develop from there.
Okay, Dr. May?
Just add on to what Dr. Presley said, I think the most important thing is feet on the ground. You really need people, dozens of people in a community this size to get out and do it. And we've got those resources. We've talked about this before. We've got hundreds of retired physicians out there and nurses out there and people who are looking for things to do. And I think one of the things we need to capitalize on in this city, and Brian, I think this is another topic for us to work on, is volunteer force. And to this, not just in healthcare, but everything else. We drive down the highways of our nation's next 2 miles is kept clean by such and such. How about on our park? This park is kept clean by Boy Scout Troop or Ladies Auxiliary or something, so we can pull financial pressure off the city, so we've got more funds to use for things that the city should be doing and getting more people volunteers. And I'd like to see 20, 30, 40, 50 people. You know, they might work 2 hours a week or they might work 10 hours a month. But getting people out there, Brian, you and I know a lot of retired physicians, and they're out there playing a lot of golf, but I think they'd like to have some more things to do.
Excellent.
And even within, you know, since we have 3 central services, that surveillance, immunization, and STD, it's sort of like that top 10 list that we looked at last year. So there's, you know, the reason we picked obesity as the number 1 issue was it's hard to find anybody arguing the other side. And so you could sit there and say, so immunizations would probably be one area where we would have an educational outreach that they would look at. Same thing when we talk about surveillance and just educating the public about what is involved in that. Recognizing that when we get into sexual health issues, that one we're going to have to really make sure that we make the rounds in terms of what the city leadership is comfortable with, what, you know, any bodies that we're looking to coordinate with. So we recognize and respect that that's going to be a concern. But I do think that, you know, the idea, like Dr. Presley is saying, of whatever areas we hit, that we envision the health educator as being the person who's going to coordinate resources and not necessarily be the one out there speaking directly. So does that give you some better sense of...
And I agree with that. That certainly will be another component of that they will have to do that also. when the resources are not available to deliver those messages. In our grants, we already have programs of education for immunization and some of those other things that are currently being done without that coordinator or health educator in place. So certainly there may not be as much activity in immunizations because we do billboards, we have outreach with the nurses that we now have. All of the advertisements and things in education are currently going on, some with existing staff. So there might be less activity in that particular aspect, and that's why we were looking for a little
And
more
now, you know, two other things that we tied
So
in.
Health in general, with obesity being the focus, could be our fourth spot. Just wanting to hear from you guys what
Yes,
important issues are.
Councilwoman Joy did ask me that sort of after the dust settles a little bit with Imagine Lubbock, that she felt like the one thing we lacked on that weight loss program, Lose a Pound, was we didn't have a 501c3, and she's asked that I speak with David Symes about possibly there being a part of that. So programs like that would be an example of, that'd be a new program working with like Imagine Lubbock, where we already have the sponsors and everything, but obesity would be a big challenge, I think, of that. As well as I think, you know, again, what we wrote in the resolution that we passed had to do with if we receive approval for the Youth Advisory Council, the health educator would be the primary facilitator over that input from that group as to programs targeting that area. So since it, just sort of like you're waiting to see if you get the educator approved, we'll have to wait and see if they approve the youth council, and if that gets approved, that would be under the direct facilitation of the health educator. So that would be kind of another busy part, I think.
Okay.
Other comments?
As far as sustainability with the role, what does the city see this role when it comes to as far as short term or long term of being a position projected out?
It will be like any other budget position that we would have, be subject to funding on a yearly basis, as one council cannot commit another one for future funding. Certainly if the need is there, I think the only issues that we've had in the past about some of these things is when we were perceptually providing programs that were being provided by other people and there was duplication, then the question always comes is, why are we duplicating? Why are we offering something that either private enterprise or another governmental or private agency is offering? And why would we do that to compete against each other? If it's already being done, then let's take the weight off of the taxpayer and let that happening where it is the most efficient. It may be that we're the most efficient in that particular area, but it may be that we're not also.
Okay. Other comments, Kay?
I think, having had years of experience both writing a health letter that was distributed by extension and went statewide at Missouri, and I edited a health letter that went out to all employees at Tech for a number of years, and then of course television. I think there's some worry about wording and what people say, and I got this feeling when we tried to educate people, and I'd just like to reassure the city that you do not get much feedback as far as that is concerned. I never got sued. I always carried insurance just in case, but a threat once or twice, but that was it. So you don't have to worry, the lawyers particularly, about express wording or that they say the wrong thing or something. It really, people are very interested in health, and the more it seems, the more information they get, the happier they are. So I would just assure you that it's not a dangerous area.
Other comments?
I think she's right.
Does that give you
We're
all?
a little oversensitive to
That give you
that
some help?
issue the most of the time, but it's to protect your tax dollars such that a simple mistake sometimes turns into something that we really never anticipated.
unintended consequences.
Right.
or something like that.
Okay. Anything else? You guys got enough to chew on there?
Oh, I think, yes.
Great,
Does
good.
anybody else have anything that you'd like?
Further? No? All right.
When do we need a decision?
Oh. They're just in the middle of budget right now, right? Just
We're just trying to get some things in structure. The two upcoming budget hearings will be next Thursday and 2 weeks from that date for official approval of the budget on first and second readings. Is that right, Mr. Klein? I believe that's correct.
I believe so, Mr. Secretary.
okay. So, and certainly we're available if council or anybody else has any questions. We'd be happy to come and try to
Sure.
offer input. Okay.
Maybe in the next week, we could forward to Brian suggestions and what we think about things.
Or even just right to Becky.
Or Becky,
Yeah.
yeah.
Okay. All right.
Certainly, once again, want to keep main focus on some things because it'll be hard. We can always bring it back to you and then ask for maybe a vote or a counter on what those priorities truly are.
And I think that'll have to be a discussion.
Sure.
Yeah. Yeah. All right.
Put it on again.
Okay, moving on 3.2, discussion regarding future goals of the Board of Health. This is just, we seem to have, we put to bed several of the issues that we spent a lot of time looking at, so I just would ask that you give some thought as to, are there other issues such as Mr. Gonzalez brought up about the LPNL and such as that. One which I'm going to begin to pursue is, without regard to whether you like it or not, the Affordability Care Act's coming down the road, and I think it would behoove us as a committee or as a group to understand what's going to be rolling out with the exchanges October 1st, with it going online January 1. And so I'll start pulling together information, and I would suggest or consider that maybe at the next meeting that if we want to form either a formal study group or just informally just to educate people so that they know what is this thing that's happening and try to cut through particularly as it rolls out. So I think that, again, a good role of our board is to study the issue and bring that information forth and try to, maybe bring in some other experts on it, other people that we can not necessarily have a resolution to present to council, but just we would like to be a resource for the community on how that's going to affect us. So if you have other things that come up, other issues that you think we should study, I think we're at a point now where we've got the time to do it. Any other comments? Dr. May?
I'd be interested in that.
Okay, good. Dr. May?
I think several good issues have been brought up, and you mentioned, Brian, the cost of electricity, sex education, the problem with illegitimacy, sexually transmitted diseases in kids, which have never been seen before in the history of the world. Another thing important here is trauma. We've always led the country in Lubbock, Texas for motor vehicle deaths per capita and pedestrian deaths per capita. I think we've pretty much held the record every year since before I came here. The Lubbock Avalanche Journal used to have a little thing on the front page every year, and they quit doing that. I'm not sure why they quit doing that, but probably so they don't scare people away from Lubbock. But just driving over here, and people sitting there, cord going up and texting while they're driving on their phones. One lady was driving on 2 phones this morning while I was just back and forth across the road. I mean, that's why I drive a 5,000-pound vehicle. I don't know why they said that. But I think this is an important issue for us to look at is trauma. We're not going to solve the nation's problem or the world problem, but I think we need to really look at it because we've got a significant problem here. We've got students, we've got very poorly trained, very discourteous drivers, I think a disproportionate amount. I spent a couple weeks down in College Station this summer, and the different driving environment down there. I felt a lot safer on the streets, and I didn't see any accidents. Well, here I drive around and go through intersections and I see accidents. And is that real? Is it not? I don't know. But I think we really need to look at what's going on here with the students, texting, cell phones, poorly trained drivers. What needs to be done? Are we not? Do we need more requirements for driving in this state? It's not a.
Okay.
It's not a. Maybe it shouldn't be considered a privilege. Maybe it should be considered an obligation to drive safely. But I think that's just
That's a good point.
Fodder to toss out. You brought up some good points, Brian.
Yeah. Okay.
Another aspect of that would be violence in our society. I think that's a very important issue that we rarely address from a public health perspective. So that might be one of our big issues.
Yep.
Okay. All right, anything else? Keep it in mind, we got a good group assembled to do exactly this kind of work. All right, Becky, what do you got for communicable disease report?
Actually, I'm going to let Mary do it.
Mary.
She wasn't supposed to be here today, but she's
here.
Yeah.
What do you got, Mary?
This is for July of this year. All enterics were at or below expected numbers. We had 2 cases of chicken pox and 4 of pertussis that were reported here. Actually, we had a total of 9 for July. But these numbers are for what was the month it was reported.
Child or adult?
From 2 months up to 90 years of age. Just
Because
all ages.
we have to remember, because there's a epidemic that takes place in the elderly population because they haven't got DPTs.
So it's a broad spectrum of ages. No insect-borne diseases, 1 new case of tuberculosis, and 5 invasive streps with no deaths.
Tuberculosis local or originating from another
In the
country?
region.
It's in the region.
In Region 1.
We don't know the origin of the person.
No, that's done by the state health department. We don't do tuberculosis at the city.
Is there any way we can find out when we get tuberculosis cases, whether this is immigrant or...
Sure, that'd be easy.
It'd be interesting I think, to know whether it's coming from the Middle East or from South America or...
Strain.
Yeah, it was a strain
Sure.
too.
Okay.
What we're dealing with, because back when I was in the military, we were dealing with avian strains out of Southeast Asia.
Okay. You do that.
All right, other? All right, Bridget, vector control. Go slap somebody.
Yes. Thanks for giving me an excuse.
Let her move over to the bicycle.
All right. I have more good news today than I have bad news, and the good news is that we have no West Nile virus positives, either human or insect, so far. We are running some awareness information on Channel 2 about West Nile virus and mosquitoes, so that should help people get educated on how to avoid being bitten in the first place. And I think even the surrounding counties, as of August the 13th, had not had any positives, so that's a good thing. Maybe we'll have a light year this year. We still have some time left in the West Nile virus season, so we're just trying to get the word out, what people can do to avoid being bitten by mosquitoes at all. And we do expect a little more activity due to the recent rain. So, that's a small price to pay for having some rainfall. And we are treating playa lakes and water sources right now, so hopefully that will take care of it.
All right, anything else? Dr. May?
Some questions for Bridget and also Dr. Presley. You mentioned no West Nile virus. How much longer period of time do we basically can emerge? West Nile virus can emerge until we get frost and kill off with the mosquitoes?
We're just now getting into true West Nile virus season.
So we are. And we're seeing, at least in my property, it looks like what we're seeing are the tiger mosquitoes that are out.
The big black ones?
Well, they're fast and they come in. Is that what we're seeing, or are we seeing species that carry West Nile virus?
Yeah, we're getting plenty of species that carry it, but right after, a day or two after a significant rain, you'll see the big black ones.
Okay.
And that's Seraphora. But the tiger mosquito is Aedes albopictus, and we're seeing them all the time. They breed pretty consistently when we're wet.
Okay.
Did you have other questions?
No, I was just curious where we stood and if there's any predictors. Well, since we're not picking up anything, there's no real predictors. Could the late frosts we had affect the emergence of it, or probably not? I would
probably not. They're going to hang around a long time, but we've been screening, and I think I'm a week behind in sending you reports, but on the mosquito screening, but we hadn't done it yet. But I did. You mentioned it earlier, discussed it a little bit at lunch, Bridget. Do you know Have you heard about the American trypanosomiasis or Chagas disease, kissing bug related stuff? There was a ProMed today. I don't know if y'all follow ProMed, but about a month ago, I was at a conference in Houston, and it was one of the key points is that Chagas disease or American trypanosomiasis is making a huge comeback in Central America and Southern North America, and we're seeing it in Texas. Not a lot of human cases, a lot of imported human cases, but where it's really getting attention, and actually we're fixing to start a research project on it down in Kerrville area, is in hunting dogs and working dogs, not just quail dogs or bird dogs, but also police working dogs, because the kissing bugs will hide in vegetation. They come out and feed, transmit the protozoa, and then go back into hiding. But it's killing dogs, very valuable dogs throughout South Texas. And we know that we have the vector here in this area. So, and it used to be, 100 years ago, it was in this area as well.
Is it a flea or a tick or
It's a kissing bug. It's a true bug. You know the big assassin bug you see around here? You don't.
I probably was going the other direction.
No, it's like, I think of another name for them.
Like a small beetle?
No, it's not a
Like a
beetle.
stink
It's
bug.
a true bug. It's
Stink bug?
kind of like a stink bug. They're true bugs, but they have a long, sharp proboscis,
Okay.
and they'll nail you, if you squeeze them or something. There's hundreds of species, but there's a few that can vector, and they're called kissing bugs. They transmit them.
Are these biting the dogs or are they?
Yeah, they're feeding on the dogs, and you've heard of Chagas disease?
Yeah.
Okay, they feed painlessly. They inject a anesthetic, and then they don't transmit it through the saliva. They actually defecate while they're feeding on you, and you scratch it into the wound. Is how the trypanosomes transmit it.
Awesome.
What are the symptoms? What are the symptoms?
Sign of Ramona.
Wow.
I'm staying clear of those things.
In humans, it's I'm sorry, I'm getting into
No, that's all right. That's all right. Okay. Last thing
I
we
was
need
wondering
to.
if she'd heard that.
It's a skin manifestation.
But you're able to see it, right? Isn't it?
We'll talk about it.
But you're able to see it though. Like,
Can I have a motion to approve the minutes of the last July meeting? Okay, moves. All those in favor? We have to have a second, do we? All those in favor, say aye. Aye. All those opposed, nay. Okay. Seeing no other business, any other business announcements, anything else? Seeing none, our meeting is adjourned. See you next month.